the surgery I had with Dr. Stone was actually the second surgery I've had on my ankle. And so the movement and the the comfort level of the ankle, everything is by far the best it's been since it's been pre the first surgery. The original injury, there was actually two injuries on the ankle, and one was a cartilage that had effectively peeled off and came free. So I needed a cartilage graft, but there was also a bone cyst in the talar dome. So the part of the bone was just kind of crumbling away. There's a little hole in it. So the surgery I did here, which was with the stem cell paste, was to have it kind of pack it in to the talar dome itself, substituting as a bone cyst, and then also the cartilage graft using the paste. So we did it all arthroscopically, and as I said, going 2 years beyond, it's as easily as good of a result as we had hoped for. So so far so good. Just keep trying to keep the maintenance of it. But yeah, I run once a week, no issues. Hike, no issues. No lateral side to side issues. Maybe a little bit of residual stiffness, if I am doing a lot of running, but it's nothing that ever lasts for like even a day. Yeah. So I mean, any type of little stiffness, and there is it is a little stiffer, so you feel it, but no pain. Look at what's being done here in terms of kind of being on there a little bit on the cutting edge of medicine, in that I was able to do something much more minimally invasive with less recovery time, but with a higher end result. So anybody else who was having, if you're having a cartilage issue, especially in the ankle, some of the other responses I'd had from doctors were, maybe you need to fuse it, you should be wearing ankle braces, all this other stuff. And here I am 2 years later, with an arthroscopic surgery as opposed to a fully invasive surgery with a great result. So I look at this as a process, right? If something about everything we've done is not durable from 5 to 10 years, and we won't know that. But if it's not, I'll be back in here, because within 6 months, I was 90%. Within 3 months, I was probably like 85%. So if it turns out that we need to do a little bit more at some point down the future, then I'll be right back in here. It's all part of a process, and that's kind of why I'm back here right now. I want to make sure that it's maintained. I look at it every year, 2 years, 5 years. That we keep it going, so to kind of prolong the longevity of something like this. And that's one thing that I've been a huge fan of here. Is it wasn't like, okay, now you've done the surgery, go get yourself a physical therapist and let me know. No, everything was monitored, the physical therapy I did here for a couple of weeks. My physical therapist, who, when I went back home, I live in Arizona, they regularly communicated with physical therapy staff here. So there was always this constant progression of knowing what was going on and keeping things, on the same progress. So, I mean, my result has been fantastic, and again, that the fact that they're doing stuff and kind of staying ahead of that curve and is, to me, is very positive. And I was able to go to everybody and say, okay, who is the best person to do my surgery? And the fact that I ended up here, and so when you look at that from a life perspective, it's like, I'm going to do the best I can for my ankle, and it's going to pay dividends in the future.